Hey everyone, this is Tammy Colburn-Consajo. Today's video is for those of you who have a chronic health condition or for those who have some kind of a medical situation going on where you need doctor's appointments and possibly tests, procedures, and maybe even surgery. So it's June 7th, 2020 in Vermont, and we have been in the coronavirus pandemic for 3-ish months or so. And this has really done a number on how we get health care and how we take care of ourselves. So I don't have to tell you, for those with a chronic health condition, extra stress creates extra pain and kind of saps the energy right out of you. I myself have a chronic health condition. I have fibromyalgia, and not being able to get my regular care has certainly impacted my functioning. So I have more pain and less energy. I'm sure that's happening to others as well. And for those of you who have had some kind of a medical situation going on, you may have had tests scheduled, all kinds of tests. You may have had a surgery scheduled that was suddenly canceled. You may have something going on with your dentist or dental surgeon where you've had to put anything off that isn't considered an emergency. So this has been scary and frustrating and sometimes depressing, anxiety provoking, and sometimes we just plain don't like it, even if we're handling it okay. So lately, the governor has allowed a reopening of things that were not deemed emergent. So now the situation is, okay, when do I go back and see my healthcare providers? How long do I have to wait? Because now there's a backlog. I've already waited for weeks, so how many more weeks or months do I have to wait? And then there's the fear of, for some of us, of, even if things are open, I don't know if I want to expose myself to potential coronavirus if I go to the hospital for a blood test, or my chiropractor, or my physical therapist. So even though we're opening up at least temporarily in the state, there's still a lot of stress going on. So I just want to say hi to you specifically and kind of give a shout out and an acknowledgement to the extra pressure that you've been under, because it hasn't been easy. I hope that you have found alternative ways to take care of yourselves as best you can during this pandemic. I know it's not going to be perfect and not as good as what you're used to. I also hope that now that things are opening up a bit, that you're able to get more of the care you need and to get some support if you have some concerns about actually going back to appointments and places that you may not want to actually go into physically. Here at Vermont Counseling and Training Center, we've done 50 plus videos so far. We started a YouTube channel during the pandemic to help support our community. So if you'd like some stress management strategies, there's a bunch on the channel. The name is Vermont Counseling and Training Center. We're also here if you want to talk to a mental health professional. We have been working with folks online or on the phone, because we also, as essential workers, had to provide our services remotely. We're slowly working on opening up in-person sessions again safely. And there are also a lot of other mental health professionals in the state if you need some professional support. So I guess the moral of the story is take care of you. You deserve it. I know that it's been challenging, and I hope that we're getting to the other side of it. And you take care. Bye-bye.